A very good morning to sir and to all my fellow friends. Today we would like to present on our title, which is Laboratory Information Management System, or also known as LIMS. But before that, I would like to introduce the presenter for today. My name is Blaire, along with my fellow friends, Aliah, Seishini, Sahira, and also Farheen. Without further ado, let's proceed with the first introductions of the LIMS.
First of all, I'm going to start to present about the LIMS. Okay, what is LIMS? A LIMS, or Laboratory Information Management System, is a type of design tool. Firstly, effectively manage samples. Second, to make data from sequencing runs easier to store, track, and assess and across the experiments. And then for that is to automate the workflows, integrate instruments, and to produce accurate results to make it more faster and reliable.
Okay.
And to pass to Seishini.
Okay, thank you, Sahira. Okay, so I'll be explaining about how the common issues impact on the health informatics. Number one is the meeting data trends. As we all know, the pandemic is an example where imaging has become more precise in creating larger file sizes and more storage capacity requirements for data. Next is the increased cybersecurity. This is where the hospitals and the healthcare systems have found themselves in targets in this rising cybercrime wave. With multiple hospitals often targeted once in coordinated attacks, this leads to more attention on the cybersecurity. The third one is the expansion of telehealth. Potential to increase the healthcare access to those in the rural areas, telehealth became a necessary healthcare technology during the COVID-19 pandemic. As lockdowns took medical officers reduce their capacity, and hospital visits were controlled. Telehealth is basically where the healthcare providers care for us without an in-person office. It can be done through computers, smartphones, and other devices. The fourth one is application of artificial intelligence, machine learning, and predictive analytics. So while on the finance and operations sides of the healthcare, the pandemic proved the true potential of AI and ML for predictive machines in diagnosing illness and advising treatment. So people got to know about their treatments and symptoms through the internet and AI at their home. The last one is the advances in electronic health record capabilities, where the ability of computer systems or software to exchange and make use of information has increased between providers, payers, and also health tech developers with new tools. That is it for my part.
Hello, I'll be talking about the purposes and importance of LIMS. First, the purposes. There are three important purposes of LIMS, and the first one is sample management. LIMS helps in tracking and managing samples throughout their entire life cycle, that is from their sample registration to storage and retrieval and finally disposal. This ensures that the integrity of the samples is maintained and prevents any mix-up or losses of the samples. Next is the workflow management. LIMS streamlines laboratory workflows by defining and automating the sequence of steps for various tests and analysis that occurs in a laboratory. It helps in optimizing the use of the resources present and also reduces the turnaround time of the test results. Next, last but not the least, is the data management. During laboratory operations, various data is generated. So LIMS helps to store and maintain this data, which includes test results, instrument readings, and other pertinent details. It also guarantees data stability, security, and integrity by managing the data. Next is the importance of LIMS. So there are three main important features of LIMS. That is, LIMS provides a complete audit trail of the samples from collection to disposal. Traceability of samples in this way is ensured, which is essential for research quality assurance and regulatory compliance. Now, traceability of samples is very important so that we can track the origin of mistakes or any mix-ups during the case of any loss of sample, etc. Now, LIMS monitors instrument calibrations, enforces SOPs, standard operating procedures, and assists laboratories in adhering to legal obligations and quality control standards. This reduces the risk of non-compliance and ensures accurate and reliable results. And LIMS lastly facilitates seamless communication and collaboration among different laboratory personnel, enabling an efficient sharing of information and reducing any delays in project execution or any delays in the processes that occur within a laboratory in order to ensure efficient patient care.
Okay, so how does LIMS works? In LIMS, there is 5 stages, which is first login stage, second is receive stage, third result entry stage, fourth validate stage, and the last one is the approval and disposition stage. In the first stage, the LIMS will be automatically assigned to a LIMS sample ID number. And then for the next stage, which is called receive stage, is where a user records that a sample has been physically received in a laboratory and is ready for testing. And then for the third stage, which called result entry, it is where a tests are completed. Then the results are entered by the test code. And then for the fourth stage, which is called validate stage, it is where used to review the test result entries. It is a last chance a user has to revise any incorrect data before passing the sample to the approval stage. And then for the last stage, which called approval and disposition stage, it is a stage where a user makes a comparison to another sample if one is available and records the results of the comparison. And then I'm gonna pass to the next presenter.
Okay, thank you, Sahira. So I'll be present on the LIMS features. Actually, LIMS has a lot of features, but however, these are the 8 components main features that can be included in LIMS. So there will be audit management, bar handling, compliance, document management, workflow, quality assurance, as well as quality control, inventory and equipment management. Last but not least, instrument and calibrations maintenance. Along with this, these are the breakdowns of the LIMS features, which is the first one is the audit management, which it will provide the centralized platform for managing compliance and the business that process the data, where all the modifications are made through LIMS that can be tracked by the audit management systems. Second is the barcode handlings, where it helps to reduce the label eligibility and also to reduce the clerical errors that happens from humans workplace, and then helps to improve data inputs and also the sample instrument and more space for the informations as on the labels itself. And the third one is the compliance, where it will help to manage the data of the sample, test, and the result, where this is also compliance between the industry and the laboratories are regulated. The fourth one is the document management. As we know, LIMS allow uploading and also indexing the practically any files or any size provide text search that will convert and export the irrelevant formats in the PDF or attachment documents. The fifth one is the inventory and the equipment management, where it helps to manage the inventories of the lab equipments, to measure and to record the data accordingly. The sixth one is the instrument calibration maintenance, where it's offered to schedule the lab instrument calibrations and maintenance for each of the instruments that provided in the laboratories. And the seventh one is the quality assurance and control. As we know, before we started with all the tests, we need to do quality assurance and control, where it will be automatic logging any of the samples and the products in the systems, and it also retrieve the management information, which it will ensure the process of the control in the data systems. And last but not least is the workflow, where it is automatically assigning tasks for the researcher for the outlining for the next location of the samples in the workflow of the laboratory. So next will be the advantages of the LIMS.
Thank you, Blaire. Okay, So I'm going to explain about the advantages of LIMS. So as you can see here, I've highlighted 2 points in yellow because these 2 points are the major benefits of LIMS. So first of all, it is the data will be reported automatically, and it is able to change data automatically within the departments. Okay, what this means is because LIMS uses a software, so all the data and all the information that a laboratory got will be reported automatically instead of manually. And it is able to change data between departments and organizations. For example, a patient's lab test result from hematology lab can be transferred to another lab by this LIMS. The next one will be increased efficiency. Because LIMS can handle a lot of tasks at the same time, it can multitask, so it could increase the efficiency of a workplace. The next one will be improved data accuracy. So with the existence of LIMS, you will have accurate and updated info about a lab test or about the lab processes. The next one would be better communication. Okay, since all the data and all the information are stored in one place, which is inside the LIMS itself, it is easier to share the information to the other members in your team. So by this as well, miscommunication won't happen because all the information that everyone got is the same because it is based in the LIMS. And then the last advantage would be easier to track sample because you will always know where your samples are or what stage of the process the samples are in because based on Sahira said they have a barcode at the sample. The next one I'll be presenting about the disadvantages. Okay, so of course, if something has advantages, they will have disadvantages as well. So the first disadvantages of LIMS is the cost. The cost could be very, very expensive to have LIMS in a laboratory because you will have to buy the software license, the hardware, and other equipments that come with the LIMS itself. And then the next one, the time consuming and complex as well as personal training is related to each other because since it's complex and hard to use, personal training is needed for someone to handle the software because it is complicated and you would have to require a few skills for you to manage the LIMS, and that training could require a lot of time, maybe weeks. So it could be time consuming. And then the next disadvantages would be data insecurity. Even though the data is accurate, but it can be vulnerable to cyber attacks and also threats. So to ensure a secure data, it needs a constant monitoring, which can be time consuming as well. That's why I said it is kind of related to each other. And the last disadvantages would be it requires a significant customization to meet the laboratory needs because each laboratory needs a different software. So the LIMS in each laboratory is different, and this could also consume the time. That is all from me. Thank you.
Hello, I'll be explaining about the differences between LIMS and LIS. So LIMS, as we all know, is Laboratory Information Management System, and LIS, which is Laboratory Information System. Now, though they kind of are similar, there is a lot of difference between them, and I will talk about them. So when it comes to laboratory type, LIMS is used in various types of laboratories, while LIS is used in specifically clinical laboratories in various healthcare institutions and such as hospitals, etc. LIMS manages various lab data, which is not necessarily patient-specific, while LIS only focuses on patient-specific data. LIMS focuses on reporting lab data for experiments and other purposes, which is used outside of also clinical settings, and while LIS emphasizes on reporting patient test results and patient data. LIMS, as it is not clinically specific, it is generally less regulated. On the other hand, LIS is subject to stringent clinical regulatory standards as it deals with patient data, which is very sensitive. Next, LIMS is not typically integrated with health information system as it is not clinical specific, while LIS is often integrated with EHR or HIS systems. Now, LIMS tracks samples for research, quality control, etc., while LIS focuses on tracking patient samples specifically for clinical testing. And LIMS integrates with a wide range of laboratory instruments. LIS also integrates with instruments, but they are specifically for clinical testing. Thank you.
Okay, so about the conclusion. So in conclusion, adopting a laboratory information management system, LIMS, is a great way to make the lab more efficient while dealing with additional loads and new types of tests. It is also a major step towards better automation and harnessing the power of healthcare data. As we can see, there are many pros despite having the cons. Because it's the usual in management system, it still would be a very advanced and useful in the future laboratories. Next. Okay, these are the references for our slides, and that's all from us. Thank you.